welcome to Doctors on TV. I'm your host, Dr. Barba-Cabodil. And I can't wait to share today's episode with you dahil dito po sa ating programa will inspire and motivate you to make positive changes for your physical, mental, and emotional well-being. Pero bago po ang lahat, mga kasambahay, kayo po ay aming iniimbitahan na i-follow and subscribe ang aming mga social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv. And like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions po and mga comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends and family. Alam niyo ba mga kasambahay na in 1902, ADHD was first mentioned by British pediatrician na si Sir George Frederick Steele? Inilarawan niya ang Attention Deficit Hyperactivity Disorder o ADHD as an abnormal defect of moral control in children. Natuklasan niya po na hindi maaaring kontrolin ng ilang mga apektadong bata ang kanilang mga kilos ng katulad ng isang karaniwang bata. Ngunit ang mga batang may ADHD ay may katalinuhan. For more details, let's watch this.
Attention Deficit Hyperactivity Disorder, or ADHD, is a prevalent mental disorder worldwide, affecting approximately 3 to 5% of people. In the Philippines, a significant percentage of 80% adolescents and 60% adults have reported experiencing symptoms associated with ADHD. This is a cause for concern as research indicates that a significant percentage, ranging from 40 to 50% of children diagnosed with ADHD also experience learning disabilities. Furthermore, a substantial portion, ranging from 30 to 50% of children with ADHD exhibit signs of antisocial behavior and engage in disorderly conduct. Additionally, a concerning statistic shows that 35% of children with ADHD do not complete high school. Meanwhile, adults who have ADHD often express feelings of frustration and isolation in both their personal and professional lives. This condition can pose challenges to employment opportunities and hinder career growth, resulting in reduced self-confidence and a diminished sense of accomplishment. Additionally, the associated negative stigma, inadequate public understanding about ADHD, and a lack of robust support networks can contribute to the development of other mental health issues such as depression, anxiety, and addiction.
Napakahalaga talaga na may alam tayo tungkol sa ADHD. Akala natin mababaw lang. May mga serious condition din po pala ito na maaaring maapektuhan ang ating mental health. Kaya naku mga kasambahay, if you suspect that you or your loved ones may be struggling with ADHD, don't hesitate to seek professional help. And for deeper understanding about this, stay tuned. Doctors on TV will be right back. Welcome back to our show. Moving forward to our discussion, as we learned in Dose of Information segment a while ago, our topic is all about affecting millions of people around the world, yet is often misunderstood and overlooked. For introduction of our discussion, let's watch this.
Attention Deficit Hyperactivity Disorder, or ADHD, is a neurodevelopmental disorder that affects people of all ages, from children to adults. It's more than just being easily distracted or hyperactive. It can significantly impact someone's life, but it can also be harnessed as a source of creativity and innovation.
And for us to be able to understand more this topic, we have invited a special guest who will shed light on what ADHD is, how it impacts daily life, and will share some valuable insights and tips for managing ADHD effectively. Let us welcome Dr. Maria MICHIKO CARUNCHO-BALOCA, a developmental and behavioral pediatrician from Makati Medical Center. Good morning, Dr. Mitch.
Good morning, Doc Sarah. It was so nice to be here. Thank you for inviting me.
Yes, thank you. And it's our pleasure to have you here. Okay, Doktora. And moving forward, mga kasambahay, let's separate the myths from the facts and gain a deeper understanding of this complex condition. And Doc Mitch will help us today. So let's get started. So Doc, what is ADHD?
So, Doc Sarah, ADHD is, as the acronym implies, ang ibig sabihin niya ay Attention Deficit Hyperactivity Disorder. So, it's a chronic condition na common sa mga bata ngayon. And it's characterized by a combination of symptoms, na mga simptomas ng hindi makafocus, sobrang mga kukulit, mga batang very impulsive.
I see. Okay, so you mentioned about the chronicity, chronic. So, pang matagalan po ito?
Pang matagalan siya, it's persistent. So, hindi ito yung mga batang minsan makulit, minsan hindi ganon to. Makikita mo yung mga behaviors na to na it lasts for a long time.
I see. Okay. And I understand may na-mention na po kayong mga signs and symptoms. So, ano pa po yung mga ibang manifestations nitong mga bata na pag nakita natin, naku, baka kailangan ng help talaga ng mga developmental and behavioral pediatrician kasi parang may ADHD. Ano po yung pwedeng mga warning signs?
Magandang tanong yan, Doc Sarah. So, because dalawang components to, meron tayong inattention na tinatawag, ito yung mga batang hindi makafocus. Mga batang ayaw nilang nag-iisip, kasi hindi sila nakaka-pay attention. So, kulang sa focus. Mga batang forgetful, yung mga makakalimutin. Hindi nila alam, saan na ba yung pencil ko? Saan na ba yung ganyan? Mga bata din, mga very disorganized. Kalat-kalat. So, in that sense, yun yung mga inattentive symptoms. Pero meron tayong mga, yun na nga, hyperactive symptoms. Parang mga pasaway na bata, talon dito, talon doon, hindi makapirmi sa upuan. Sabi ng ibang mga guro, parang supervisor, ikot ng ikot sa classroom. Mga ganong klaseng mga bata. Sabat ng sabat sa mga conversation. Di ba? Mga batang may kausap si mommy at daddy, bigla na lang, sabat ng sabat.
Hindi makakontrol, mag-i-interrupt.
Exactly. Mag-i-interrupt palagi. So, mga batang mga ganon.
I see. Okay, so very wide range pala ng manifestations. And ano po bang sanhi ng ADHD?
Ang ADHD is primarily genetic, no? Ibig sabihin, may mga nangyari during the time na yung brain ng bata ay nagde-develop pa lang sa loob ng bata. So, it runs in the families. Ibig sabihin na may mga parents can have ADHD also, or may mga relatives sa pamilya na nag-show ng mga symptoms of ADHD. So, ganun.
Okay, but during the time of consultation, how about kung hindi ma-extract or hindi nila ma-recall if somebody else in the family has actually been diagnosed of ADHD?
That's a good question. Kasi ang diagnosis ng ADHD, it's comprehensive. So, hindi lang behaviors. Tinitignan din natin ang prenatal history. Ibig sabihin, kamusta ang mommy na pinagbubuntis pa? Premature ba ang bata? Si mommy ba ay may exposure sa cigarettes, drugs, or alcohol? That can cause symptoms of ADHD also. So, mga ganong klaseng mga issues, tinitingnan din natin.
Okay, so this reminds us na talagang dapat laging healthy ang ating mga nanay during the time of pregnancy.
Correct.
And of course, you mentioned about smoking. So this doesn't only mean about, we're not pertaining to active smoking lang. Pwede yung baka may kasama ho sa bahay na mga smokers. No?
Correct yan. That is very true.
Yeah.
Second-hand smoke.
Yes, okay. Ito po, how about, di ba kanina you mentioned about yung sa genetic predisposition, no? Okay, and say for example, yung particular patient, okay, so hindi maalala kung meron bang kaanak na merong na-diagnose ng ADHD. So ito ba, paglaki ba nila, may mga ADHD patients nagkakaroon din ng family?
Oh, yeah. Yes, absolutely.
So how about yung risk of of them having yung kid nila would be diagnosed also of ADHD later on?
There is a higher risk always na yung anak nila magkakaroon ng ADHD, symptoms of ADHD, or even other kinds of mental health disorders. So yan, may risk talaga dyan. Mas mataas ang risk.
I see. And Doktora, in your practice, no, How young po yung youngest, okay, na usually nadadiagnose mo ng ADHD?
So, ang pinaka-earliest na masasabi mong madadiagnose mo really with ADHD is at 4 years old.
4 years
So,
old.
before that, kung ang anak mo ay 2 or 3, makikita mo na, oh, ba't sobra naman yatang kulit nitong anak ko. Makikita mo na yung mga simptomas. Pero yung actual na talagang idadiagnose mo ang bata with ADHD, mga 4 na yun. Yung formal diagnosis.
I see, and yung oldest ADHD diagnosis of it.
You know, you can be diagnosed with ADHD kapag ikaw ay adult na. Pero hindi ibig sabihin na bigla ka na lang nagka-ADHD. Ibig sabihin nun, nung bata ka, meron ka na mga simptomas. So, tinitignan natin yun bago natin i-assess ang isang adult na may feeling mo may ADHD ka as an adult, then titignan natin ang history mo nung bata ka sa school, mga magulang mo, interviewin natin like that.
So probably hindi during the younger years nung adult patient na yan, hindi lang nakita na ganun nakakabahala. That's why hindi naipa-consulta, okay? Kaya hindi nagkaroon ng diagnosis of ADHD. And okay, so ito po sa mga ating mga viewers na may ADHD silang mga anak, usually paano ba dinidiscipline yung mga batang ganyan?
Yes, ang discipline is very important talaga. Kailangan sa bahay, you have to have structure. And when I mean structure, yung ibig sabihin, kailangan may mga rules tayo. Kailangan may mga expectations. Kailangan may mga limits. So, hindi pwedeng ang mga bata ko ano na lang ang gusto nila. Yun na lang ang gagawin. Kailangan may mga patakaran na sinusundan sa bahay.
And sorry to cut you, this holds true also with ADHD kids.
Yes, oo.
Okay,
that's true. Whether or not.
Yung regular or normal individuals, normal kids, including the ADHD kids mo, so pare-pareho yung ruling. Basta dapat may structure.
Yes, mga routines and structure. So kailangan meron ka ding mga consequences kung sila ay syempre nagmi-misbehave, di ba?
Yes,
so important din yun.
And paano ba sila mag-isip, doktora? Kasi parang, syempre, yun nga, katulad nung na-mention, usually yun ang common understanding ng mga individuals. I'm sure the viewers would agree also na nakalimitan, yung mga ganyan, walang focus, o kaya iba hyperactive. Okay, so pero ano ba yung mga iniisip nila? I mean, sa studies, would you like to share sa viewers?
Siguro, kung ikaw ay adult na may ADHD, siguro yung pag-iisip mo very disorganized. Yung parang, ang dami kong gagawin, hindi ko alam kung saan ako mag-uumpisa. Nawawala yung aking pencil. Saan ko na ba nailagay yun? Alam mo yun, very disorganized ang pag-iisip, madaming ginagawa. So, hindi kasing organized at hindi natatapos ang mga gawain. For example, kasi that's one thing na mahirap sa kanila.
Lagi pong may worries?
Worries or more like hindi nila alam kung ano yung unang uunahin nila sa gawain nila. Hindi nila napaplano ang kanilang araw para nagagawa na nila lahat. Kaya itong mga ganitong mga individuals, kung adult ka, marami sa kanila nahihirapan sa trabaho. So marami sa kanilang palipat-lipat ng trabaho dahil hindi nila magawa lahat ang kanilang tasks sa kanilang work.
I see. And based po sa studies, okay, ano po exact na finding sa brain ng mga individuals na may ADHD?
So, tama ka. Meron talagang pagkakaiba ang mga brain ng mga individuals with ADHD and not. Ang structure ng usually the frontal or yung dito sa harap ng brain ng mga ADHD kids are underdeveloped. Pagkatapos ang mga chemicals, ang tinatawag nating neurotransmitters sa brain or utak ng mga kids.
Ito po yung mga chemicals, doktor, na kailangan po para sa signaling. Ibig sabihin yung pagpasa-pasa ng kuryente para makapag-isip o kaya kung kanyang motor, makagalaw tayo. Na ito po yung mga neurotransmitters.
Correct. Oo. Specifically yung dopamine and norepinephrine. So kulang ang chemicals na ganyan or may imbalance sa brain. So alam natin, there is really something different, pagkakaiba.
Okay, ito and pasintabi of course dun sa mga viewers na nanonood na may ADHD ang kanilang mga anak or kung may mga mahal sila sa buhay, Gusto kong malaman, doktora, marami rin po bang nagpa-perform? I mean, Does it mean po yung abilities, okay, ng mga ADHD, does it mean ako-compromise po because of the condition that they have?
Absolutely. Actually, yun yung one of the things that we need to consider before you diagnose. So hindi ka lang makulit, hindi ka lang magulo, but at the same time, meron kang mga impairments. Ibig sabihin, hindi mo nagagawa ang work mo, kung bata ka sa school, medyo yung grades mo bumababa, hindi ka nakakasabay sa mga classmates. One other important characteristics is mga batang with ADHD, they have problems sa kanilang social skills. So sa kanilang mga kaibigan, yes, sa mga kaibigan nila, maybe nakikipag-away sila or hindi sila magaling mag-share ng mga bagay-bagay, nakikipag-unahan.
Kumbaga challenging po sa part ng mga karelasyon nila.
Exactly.
Okay, and pero dun sa part ho ng iba na nakapaligid sa kanila, paano kaya nila makapag-focus sa kanila or paano ho ba makipag-usap sa isang individual with ADHD?
Siguro because they're very distracted. Halimbawa, yung anak mo, mayroon kang isang anak na alam mong may ADHD, pagkakausapin mo siya, make sure na nasa isang place ka na walang maraming distractions.
Para sa'yo lang po ang focus.
Yes, wag nakabukas ang TV, wag nakabukas ang cellphone or gadget. So make sure na palagi mong kakausapin na one-on-one, for example. Minsan kailangan mong uulitin ang sinasabi mo. Make sure na nakatingin sa'yo and looking at you in the eye.
I see. So basically siguro dapat papasok dito yung support system ng family na kung sino yung nakapalibot dun sa kanyang anak, maganda rin siguro maintindihan ng mga nakapalibot, okay? But of course, hindi naman natin gugustuhin na parang nagiging discriminating ito. However, it's like more understanding ang naibibigay. Kalimitan naman sa atin, magkakaibigan, magkakasama sa trabaho. Alam mo yun, maganda naman ang samahan, hindi po ba? At saka ngayon, of course, naiintindihan naman natin yung mga condition ng mga ibang individuals, okay? So para mas mamuhay ng normal itong ating mga kasamang may ADHD. And does ADHD coexist with other conditions?
Oo. Tama ka dyan. Kasi madaming ibang conditions na madadiagnose. Hindi lang ADHD. Maraming mga bata, for example, na may mga learning disability din. Mga batang sa grades nila bumababa, hindi nakakasabay sa ibang mga classmates. So there's learning disability. May mga batang also may conduct disorder, yung mga pasaway na to. Ito yung mga behaviors na medyo severe na. Mga batang also with depression or anxiety. Yes, so pwede kang ma-diagnose ng ADHD, pwede ka ring ma-diagnose at the same time meron ka ding depression, anxiety, or learning problems.
I see. Okay, pero meron din po bang mga ADHD patients na, they excel naman sa kanilang field?
There are individuals na ganon, and because minsan kasi pag ADHD hindi ka napapagod pag mata.
Yeah.
So yung kanilang drive and motivation na ganon, yung kanilang very hardworking abilities or personality drives them to succeed in their field.
And sometimes even more than a regular or normal individual. Okay, that's good to know, no? Okay, and usually, paano po, kunyari, pag dumating sa inyong pasyente, no? And I'm sure with your practice, no? Talagang, we've been hearing na napakaganda ng practice nyo napakaganda ng practice nyo, Doktora. Congratulations for that. And pag dumating ang isang pasyente with ADHD, medyo kita nyo na ba na most likely it's ADHD talaga?
Kung oobserbahan mo ang bata, makikita mo sometimes. Makikita mo na sobrang kulit. Makikita mo yung clinic mo sobrang parang dinaanan ng bagyo. Ganon ang itsura niya.
Parang gusto ko mabisita ang inyong clinic. I would want to see kung paano ba. Kasi syempre, of course, kailangan kasi 'di ba may mga something that can capture. So I have been hearing how different ang mga clinics po ng mga developmental and behavioral pediatrician. And paano ho nyo nadadiagnose na ito ADHD? Kasi of course, sabi ko nga kanina, Doktora, pag ba na-obserbahan nyo, ADHD na. Pero sabi nyo nga, it depends of course. So, kailangan nating observan. And apart from that, what diagnostic measures do you usually conduct to come up with that?
So, alam mo, walang diagnostic labs or walang mga imaging procedures, walang x-ray, walang CT scan, walang mga blood test ang makakadiagnose ng ADHD. So, most of the time, kailangan natin talagang a very comprehensive history, interview with the parents, also most importantly, ang tinitingnan natin is a checklist of the symptoms. So, bibigyan natin ng checklist ng parents, for example, hindi lang parents, pati ang teachers, or kung saan man nagmamanifest yung mga ADHD symptoms na yan. So, kunyari, kung nag-tutor ang bata, kung nagsusports. So, itong mga taong itong nakapaligid sa batang ito, kukunan natin sila ng observations. Kasi yun ang basis ng ating diagnosis is a very comprehensive observation ng kung ano ang behavior ng bata sa iba't ibang mga larangan ng kanilang buhay.
But that's good to know that these people around an ADHD patient, they do like they cooperate and support. Okay, just so para matulungan ang bata. Okay, and kapag po na-diagnose na ng ADHD, usually paano niyo po hinahandle to or how do we manage that?
Ang management primarily is behavioral. So, ang bata, ang ginagawa natin is that we usually refer to a behavior management professional, like an occupational therapist. So, itong mga behavior management program, tinuturuan ng bata kung paano sila mag-focus, how to finish their work in school, tinuturuan sila ng mga skills para sila maging functional sa kanilang classroom, sa bahay, sa kanilang mga kalaro. So basically, behavior management, especially sa mga maliliit pang bata or the younger kids. We do recommend a lot of parent training. So kailangan ng mga magulang din tinuturuan sa bahay.
Very challenging talaga. Dapat kasama po sa training ang parents.
Talaga.
Okay, kasi sila ang kasama. But you mentioned about the skills. What kind of skills do we subject them to?
So pag OT kasi or occupational therapy, usually yan mga structured activities tsaka play, naglalaro lang. Kasi ang mga bata, hindi mo naman matuturuan yan except na in the context na naglalaro. Kasi ang mga bata, paano ba ang mga bata natututo? Usually ay pag sila naglalaro. So ang mga OT, may table, tapos maglalaro sila para maturuan ng mag-wait. Mga batang may ADHD, nahirapan silang maghintay. Gusto nila sila una, gusto nila ngayon na. So in a context of playtime, natuturuan sila ng wait, my turn, your turn, ikaw muna, ako muna, mamaya ka na, hintay ka muna. So,
I see.
natuturuan
Okay,
sila.
so nagiging patient na rin sila.
Exactly.
And ito, if I may mention, kasi yung mga kids ko, I have kambal, and nagsiswimming po sila. Before their schedule, meron pong grupo ng mga may ADHD na mga bata. And
masaya
they're
yun.
really good swimmers.
Yeah.
Yeah, and I really commend tong mga coaches talaga na tumututok dito. And just like what you mentioned, yung mga OT, kasi syempre, sila yung talagang regularly nasa kanila itong mga batang to. Nako, napakagandang panoorin ng mga batang ito na may ADHD. Talagang marami naman talaga, may hope talaga. Okay?
Oh, yeah.
Yeah, definitely, no. Ito po, naku, ayan mga kasambahay, baka nalulunod na po kayo sa mga impormasyon na ating nalalaman, no, mula dito kay Doc Mitch. Okay, kaya pansamantala muna po natin titigilin ang ating talakayan. Kaya naku, wag pong ililipat ang channel. Doctors on TV, we'll be right back. Pa rin po sa pagpapatuloy ng ating talakayan, still here with us, Dr. Maria MICHIKO CARUNCHO-BALOCA, a Developmental and Behavioral Pediatrician from Makati Medical Center. Ito na, Doktora, tatalakayin naman natin ngayon ay tungkol sa prevention. So, is there any way to help reduce one's child's risk of having ADHD? Though I'm sure you mentioned about yung genetic predisposition kanina.
Right. So, I guess one of the best ways is for you, ang mga nanay dyan, na alam mong gustong magbuntis or something like that, na kailangan pangalagaan ang kanilang kalusugan habang nagbubuntis. Gaya ng napag-usapan natin kanina na make sure na walang nagsasmoke sa paligid niya, huwag magte-take ng drugs, palaging pupunta sa kanilang OB para magpa-check up, alam nila kung ano yung mga bawal at hindi dapat gawin. So, basically, yun, kailangan healthy sila para maiwasan yung mga risk factors na ganon. So, yung isa namang genetic na if it runs in your family, that's hard. Mahirap naman yun makontrol, no?
Non-modifiable na.
Yeah.
Okay. O siguro, di ba, anything naman pag pinaghandaan mo, like for example, you would want na magkaroon ng anak. So basically, kailan mo ba plan yan? So ahead of time, okay. So mas maganda pa rin naman anytime you can start na living a healthy lifestyle. Okay, but of course, mas may emphasis tayo dun sa mga, like ako, I remember, I wanted to get pregnant in December 2010. So as early as May prior to that, nagpakabait na po ako. And of course, kasi may kanya-kanya tayong mga inclination. Okay, so merong mga mahilig sa ganitong food, ganyan. But of course, hinanda ko na kasi alam ko, I needed to be healthy para sa ikikerry ko na kids. Okay, so siguro maganda rin yun, para at least alam na natin yung mga dapat iwasan. And I remember, nag-iwas din ako punta sa mga yung matataong lugar. Okay, especially nung naging pregnant na ako. Kasi you may get any viral infection. Okay, that can affect actually the babies in your tummy. Okay, and ito, doktora, how does behavior management help in preventing ADHD?
So yung behavior management, hindi naman siya magpe-prevent, pero it will teach the child mga skills para maging mabait sila, functional, hindi masyadong makulit. They can learn skills to focus, pay attention kay teacher, follow instructions. So, pag meron silang mga ganong skills, so yung mga symptoms would be less. So, makokontrol mo, mamamanage mo yung symptoms. Pero yung diagnosis, yung ADHD na pagka-ADHD, it will still be there.
Yun pa rin siya.
Yes.
Okay, and kanina you mentioned about having a structure po, yung mga rules and regulations sa household. Kunyari, merong misbehavior. Okay, so di ba may mga negative consequences. So ito bang negative consequences na to can actually change their behavior?
It can change their behavior. So, one way also to help minimize the symptoms is, syempre, kailangan may mga tinatawag tayong protective factors sa family. Ito yung having a loving family, security in the family, parents who are responsive, and parents who set limits. So, kailangan, like what we said, may rules sa bahay. Hindi pwedeng kung ano-ano na lang gagawin ng mga bata.
And
no?
it would be just okay, no?
Yes. Yung negative consequences na tinatawag natin are also known as natural or logical consequences. Ibig sabihin nito, pag may ginawa ang bata, natural, meron yung kasunod na mangyayari. It's either good or bad. Kung maganda yung ginawa nila, then they
May
get
reward.
may reward. So that's positive reinforcement. Ngayon, kung halimbawa medyo tamad sila, let's say ayaw gumising. Kung ako ayaw kong gumising ng maaga, anong mangyayari sa akin? Malilate ako sa trabaho, papagalitan ako ng boss ko. So yun yung mga tinatawag nating logical consequences, no? Pag ng bata, for example, ayaw kumain ng kanyang dinner or ng lunch, ibig sabihin baka, sorry, hindi ka na makaka-dessert. Pwede mong sabihin ganun sa bata. Kung nagkalat ang bata, kinalat niya lahat ng toys niya, anong kailangan niyang gawin? Kailangan niyang linisin. So, kailangan ganun tayo sa bahay.
We have to be firm.
We have to be firm. Hindi pwedeng okay kay mommy, pero kay daddy, bawal. Most of the time, takot ang mga bata kay daddy, di ba? So,
kay daddy ba? Ba't parang sa akin kay mommy? Okay, so ito po, and okay, sige, ito. Yung treatment naman po ng ADHD, kasi kanina, okay, nakita natin yung how to handle sa kanila ganyan. But of course, with regards to sa medical management, paano po yung approach na ginagawa nyo dito sa mga kids?
Right. So, by a certain age sometimes, minsan, hirap pa din kahit may behavior management. So, that's when we prescribe medicine. So, may mga batang kailangan talaga ng medisina. And ang binibigay sa kanilang tinatawag nating mga stimulant medicines or drugs.
Stimulant po despite the patient being hyperactive.
Yeah, oo. So, hindi ibig sabihin na mas magiging hyper sila, no? Yung ibig sabihin ng stimulant is they become more alert. So, mas kalmado, mas alert sila para nakakaisip sila ng mas kalmado, mas nakaka-focus sila sa trabaho nila sa classroom. So, ang ibig sabihin lang nun, mas alert.
Mas alert and then mas nakaka-focus sila.
Yes.
Okay, but ito, doktora, narinig natin, di ba, na amphetamines daw can also be used to treat ADHD in children. How true is it?
It is true. So, certain kind of amphetamines can be used for kids with ADHD. In the same manner kasi, stimulant sila because they become more alert. So, pero ang use ng amphetamines, kailangan regulated and you have to only be using it kung ikaw ay may ADHD at under the guidance ng doktor. So, kaya it's a very regulated drug.
I see. Okay, and yung mga na-mention po ng mga medication, how do they actually work? Ano po yung ginagawa nila para ma-improve yung mga condition po ng ADHD patients?
So, kaya nung kaninang na-discuss natin, no, sa brain ng bata, may imbalance sa chemicals, no? So, there's parang kulang ang tinatawag nating dopamine and norepinephrine. So, ito yung mga neurotransmitters. So, ang mechanism nitong stimulants ito ay inaangat nila yung level ng chemicals na yon in the brain to make the child be able to pay attention more, para kaya ng bata na ang tinatawag natin is self-inhibit. Yung makontrol nila yung behavior nila para hindi sila impulsive, hindi na lang yung biglang mag-act without thinking. That's one thing kasi na impulsive sila kasi magsasalita without thinking. Kung ano-anong sasabihin, hindi sila nag-iisip. Kung ano-anong gagawin, hindi nag-iisip. Yung mga batang bigla na lang tatawid ng kalsada,
yeah,
diba?
So we do not want that, baka ma-aksidente.
Exactly.
I see. And so okay, so ito bang treatment na to, yung mga minention nyo, for how long will this be given sa mga may ADHD?
So ideally, we don't want them syempre naman na naka-medicine ng matagal for a long time. Kaya it's very important na nagpa-follow up sa doktor para we know how long we can give it. So because minsan with ang medicine, kailangan kasama ng behavior management. That's the best intervention na hindi lang gamot, pero kailangan may behavior management na kasama para yung bata, at the same time, they learn the skills na important for them. Now, pag sila ay nag-mature na, for example, natuto na sila na mag-pay attention, natuto na sila na mag-behave, then maybe you can opt na and say, baka hindi mo na kailangan ng gamot. Yeah, baka ganun. And if nagpa-function na, let's say yung grades are better, sa bahay, kaya na niyang makontrol ang kanyang behavior. So, important na may behavior management and OP.
I see, but can ADHD be cured completely?
So, because it's a brain-based disorder, it's neurologic, we don't really say na
Complete.
We don't say na, okay, wala na akong ADHD, gumaling na ako. Hindi. So most of the time in kids, kung meron kang ADHD, you can overcome many of the symptoms. So maybe because marunong ka na kung paano mo i-control yung sarili mo, no? Pero in about 40%, 30 to 40% siguro ng mga adults, yung symptoms makikita mo pa rin. But maybe in a less severe manner naman.
Okay, but you mentioned about the severity. So, meron bang degree of severity po ang ADHD?
Pwede mo naman ma-qualify yon as mild or moderate or severe. Usually, the ones with attention deficit lang, yung inattentive, maybe that could be a little bit mild lang siguro. Yung combined, which is both inattentive tsaka yung sobrang hyper, that could probably qualify as the more severe version.
I see. Okay, kasi parang hindi definite yung ano niya, yung mga criteria dun sa sa combination. Okay, and doktora, ito, usually 'di ba common siya among younger kids, okay? And then how about 'di ba pagka sa pedia, usually you handle hanggang 18 years old. Okay, so how about kung kunyari beyond 18 after once the patient has reached 18 years of age already and siyempre, adult na siya considered, no? Paano po yun? After sa developmental and behavioral pediatrician, who handles them?
You'll be surprised kasi sometimes I see patients who are adults also.
Oh.
Yeah, pero for that particular questions, yung mga kids na may ADHD, most of the time they can be transition to a psychiatrist.
To a psychiatrist.
Yeah.
But of course, kasi kunyari for the longest time, they've been with you already. Siyempre, mahirap din siguro yun. Kasi this entails a lot of trust also, di ba? Doon sa manage sa kanila. So, I understand, mahihirapan yata sila sa transition if another one would handle them. No?
That's true.
I'm just very curious about it kasi, oo nga, no? Who handles, kasi I'm sure baka curious din ang ating mga viewers.
Yeah, that's true. Totoo yan. But yeah, for me, meron akong mga patients na 19, 20, ganyan. I don't see them as often. Hindi naman palagi. Katulad ng mga bata, mas palagi ko sila nakikita. But once in a while, nakikita ko sila, kamusta ka na? nag-work ka na pala, ang galing naman. Ganyan.
Thank you very much kasi nararamdaman ko yung kindness nyo dun sa mga pasyente nyo. I really can feel it. No? Thank you very much. And with that, Doktora, baka meron kayong mga like final words para sa ating mga viewers.
So, siguro ang masasabi ko lang is that always make sure that you know what's going on in the house. Make sure na you provide your family with love, security, and also always be in touch with your pediatrician kasi yung pediatrician mo ang first line and first person that you will be able to talk to and guide you kung anong kailangan mo. So, and also, siguro yun lang, to be a good mother, you also have to take care of yourself. Diba?
Kasi how can you take care of your kid, diba?
Exactly.
If you're not okay as well.
Exactly.
Okay, and would you like to invite our viewers to visit you here at Makati Medical Center?
Yes, I'd like to invite everybody, kayo pong mga nanay, kayo pong mga family, daddy, and all that. Please visit us here in Makati Med. Kung meron kayong kailangan, we're always just here and we take care of, your needs and your health. So,
okay, thank you very much again, Dr. Maria Michiko P. CARUNCHO-BALOCA, a Developmental and Behavioral Pediatrician from Makati Medical Center. We hope mga kasambahay, marami po kaming naitulong sa inyo para madagdagan ang ating kaalaman tungkol po sa ADHD. Nako, pero hindi pa po nagtatapos dyan ha. Let's add some short parenting tips for ADHD.
Magandang umaga mga kasambahay. This morning, pinag-uusapan nga natin ang tungkol sa ADHD at kung paano ba ito i-manage naturally. Ang Attention Deficit Hyperactivity Disorder o ADHD ay isa sa pinakakaraniwang mental health disorder na makikita sa mga bata. Sa Pilipinas, tinatayang may 3 to 5% na populasyon edad 1 hanggang 14 years old ang mayroong ADHD. Bukod sa therapies, malaking factor rin ang food intake sa mga taong mayroong ADHD na nakakaapekto sa kanilang hyperactivity and other mood swings. Iwasan na po ang kahit anong caffeinated energy drinks and chocolates sa kanilang mga diet dahil ang excessive amount of sugar and caffeine can cause hyperactivity and inattention. Alam nyo ba mga kasambahay, ang large amount of sugar and caffeine may worsen ADHD symptoms. Ang ice cream din po and other dairy products, also like milk, cheese, and yogurt, can also intensify ADHD symptoms in some children. Kaya mabuting umiwas na po tayo dito. Ang pagkain ng itlog, isda, at karne na mayaman sa protina ay maganda sa mga taong may ADHD. Dahil ang protina na nagmula sa mga ito ay makatutulong sa kanilang utak para maglabas ng mga neurotransmitters na kailangan ng katawan sa pagiging kalmado at mahinahon. Very simple lang mga kasambahay, pero malaki po ang maitutulong ng mga tips na yan para magkaroon ng focus ang ating mga anak. See you again next week for more natural tips. Muli, ako si Jason Sanchez, your integrative medicine doctor. Please follow me on my social media accounts, Jason Sanchez, Doc J. Because natural is beautiful, only here at Naturally Yours.
Before saying goodbye, I would like to greet my kambal, Iyo and Iya. Hi to EJ also and to Doc Alain. And of course, Nanay and Tatay, I miss and love you both. As we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their continued support. We hope you enjoyed our show and found it informative, entertaining, and enjoyable. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969 175 423133 or 02 8824 5217 or 02 881 30320. Organic acai. Support your health with 100% organic superfood supplement, Organic Acai Premium Blend, and acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating atikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.